you have to understand these programs in depth. You may be aware of programs like remote patient monitoring, chronic care management, remote therapeutic monitoring. We'll get into all those in a second, but there's so many more that they just introduced. One's around helping patients navigate new cancer diagnosis, one to help train caregivers. There's even one to help understand what is going on with the patient from a pain standpoint. All these different new reimbursable opportunities are there for you to grab, but you need to do a deep dive in really understanding it. If you're struggling to start your remote care programs, I have some solutions for you. Let's talk about how you go from 0 to 1,000 patients in 90 days with remote care programs. I'm gonna walk you step by step on how to get started today. That's right. If you're a medical practice owner, these are some ideas that we've seen work when it comes to scaling your remote care programs effectively and efficiently across thousands of patients. I'm Theo. I run a large remote care business. We do over 7 figures a year, and we manage tens of thousands of patients across the country. So we have a little bit of experience on how to get started with these type of programs. One of the things that we've seen is that number one, you have to understand these programs in depth. You may be aware of programs like remote patient monitoring, chronic care management, remote therapeutic monitoring. We'll get into all those in a second, but there's so many more that they just introduced. One's around helping patients navigate new cancer diagnosis, one to help train caregivers. There's even one to help understand what is going on with the patient from a pain standpoint. All these different new reimbursable opportunities are there for you to grab, but you need to do a deep dive in really understanding it. We've had practices, for instance, one practice was really struggling. There was a cardiologist specialist out of Macon, Georgia, that was really struggling to meet the needs of their patients via telehealth. One of the things they struggled with mightily was just understanding how these different programs can mix and match. Number one, they were a specialist, so it was a lot difficult for them to understand exactly what they can be reimbursed for. For instance, they did not want to bill for different type of codes that would interfere with the referral network, which tend to be primary care internal medicine. So when they sat down and discussed with us what their needs were, we really mapped out a plan to look at all these different billable codes that allowed them to efficiently and understand exactly what reimbursable codes would be allowed as a primary or a specialist. One of those codes was around principal care management. This is a code that allowed them as a specialist to bill for one chronic condition. So that was really efficient for them as they kind of got started. So this is something you have to understand. You can either do it several different ways to get the learning. You can go to seminars to understand that. There are a lot of programs out there you can understand the latest and greatest and be aware of it so you can take advantage. You can learn it yourself, right? You can start to build and try it out to see how it can be beneficial to you and your organization. So you may start with a couple of billable codes that make it simple and easy. That could be easy. Or the last thing is you can bring in coaches, right? You can bring in experts who this is all they do, helping them walk practices like yours through each step of the process in order to ensure that you're maximizing revenue. You don't want to waste time and energy trying to understand this process efficiently. So you really have to understand these codes, all the billing requirements, and also you need to be aware of insurances, right? Insurance is changing. Some insurances accept it, some don't. Right now, a lot of these remote care programs really rely on Medicare, Medicare Advantage, but there are some programs like continuous glucose monitoring that do not require a Medicare diagnosis. So basically someone who's 65 and above or is just classified as being on Medicare. These are some things and nuances you need to be aware of as you get started down that path. So that's the first step. It's always about awareness, right? Before you begin any journey, it's best to have a map to understand exactly what the path is going forward. So now that you kind of understand the journey, the second step is you need to have a workflow. What does that mean? That means understanding every step of the journey when it comes to your patients. One of the things that we walk a lot of our clients through is just making sure they understand everything from patient recruitment to patient acceptance, to patient onboarding, to patient delivery of devices if that's necessary, to delivering service to the patient, all the way to patient exit from the program. So these are the steps you have to understand clearly before you begin anything. For instance, if you're going to recruit, you need an efficient way to communicate with them. We have a standard operating procedure where we utilize scripting that allows us us to communicate consistently to patients that we know will give us the best response. A lot of patients are unsure, don't see the necessity of it, but we've seen a lot of more acceptance, especially due to the fact that you as a medical professional realizes that this is something they need and can really help them. Next, you have to go through the onboarding, whether you're providing devices like scales or blood pressures, but even if you're doing things like providing services over the phone, telehealth options, training type mechanisms, you need to make sure you walk the patient through that experience, right? You don't want the patient to be confused and not understand what they're on there for. Part of that process is consent. A lot of these programs require patients to understand exactly what they're getting into. So you really need to make sure you have their consent as you kind of go through that process. We've seen time and time again when patients get confused and not sure about what these programs entail. A lot of times what we do is kind of walk them through the benefits of these type of programs and why they need to be on it. For instance, if they have hypertension, high blood pressure, it's really important for them to have it under control because a lot of other issues like heart disease can evolve out of that. But more importantly, having conversations with the patient guides them to understand the importance of monitoring that because they have longer term goals. Maybe your patient wants to be able to see their daughter get married, right? And make it for the wedding. Maybe they want to be able to do exercise more and be out with friends or enjoy outdoors. You really have to have those conversations in that recruiting phase. So as we continue thinking about this workflow, you need to understand, okay, now how are you going to deliver this service? As practices struggle with hiring individuals for remote programs can be just as difficult. You need individuals who understand the necessity of having a clear and clean manner when they're on the phone. You need to ensure that the remote staff, and this could be whether nurses or medical assistants, need to understand the framework of how they're guiding a patient and building a connection via the phone. We do tools such as motivational interviewing, where we're guiding them toward a path to understand exactly what makes them feel good about this path forward. So we've seen practices that implement this are able to keep patients engaged 90% of the time throughout the month as you're delivering these programs. And how you're doing that? Because you form a bond, an extension, and guiding them in that path to success. Once you have that, you need to understand the process of, for instance, if a patient unfortunately expires, then how do you kind of handle that process? And we've seen that making sure you have a process in place so you don't bill for those patients that unfortunately expired. You need to also be aware of how you're going to handle incidences where patients change insurance. You need to consistently check that. Having this clear workflow and clearly defined really helps to get clear in your mind the steps and pieces. Likewise, if you're a medical professional, understanding workflows and best clinical decision making is really key. And we've seen the same way with these type of programs because this is a mix of technology combined with operations combined with clinical work. And when you look at this, you have to combine all three perfectly in order to align and get these programs to work effectively. So we talked about understanding the requirements for all the different programs. Next, we talked about the workflow. And then you need to make sure the next step is guiding your team towards success. What does that mean? That means having a clear vision on what you're building here. We talk about this a lot, a patient-first culture. So what does that mean? That means understanding succinctly what is guiding the patient and is going to be best for the patient. For instance, yes, you could provide all these different services to the patient, but maybe the patient doesn't need 40, 60 minutes a month. Maybe they only need 20 minutes with a nurse calling them to check in on their chronic condition. Maybe understanding the benefits to the patient, but more importantly, understand when maybe they don't need to be on these programs, right? Maybe they've improved so much that it may be time to take them off. Patient-first culture ensures that's from the front desk to the back office. So the front desk, when they're coming into your physical location, making sure your front desk staff is friendly and kind and greeting them so that when you introduce them to these programs, they're more acceptable. On the back office, making sure it's clearly explained exactly what the billing requirements are for these type of programs, if they're receiving devices or if you're providing your remote nurse services. This is very key because if you have buy-in from your team, then you have structure. And then once that structure is together, then they understand what they're accountable for. This is so key. We've seen time and time again where practices fails because it's not communicated properly to their staff. And unfortunately, let's be honest, a lot of doctors struggle with communication channels with their mid-levels. And it's good to ensure you have those good, clean communication channels. If you don't, it's going to fail. And a lot of times what we see really work well if your practices really look at ways to incentivize team members who are following the workflow. This means providing clear guidance of what's expected. And then if they go above and beyond that, providing a reward system. For instance, I know a practice that has quarterly goals that sets for their team members to meet when it comes to patient engagement and making sure patients stay positive in these type of remote care programs. If the team members within the practice follow this workflow and go above and beyond what's expected of them, they get rewarded. It may not be a monetary reward, maybe a simple gift card for a lunch, or maybe a team party that they can get together. But it's something to recognize that, look, you went above and beyond and you need to be recognized. And that's so key, creating this patient-first culture. Next, you want to make sure that you have the partners in place. So we talked about understanding the programs effectively. We talked about having a workflow. We talked about having a team. That's your internal team. This is part of that team building structure as partners. You can't do these programs alone. You're going to need technology. You're going to need devices if you're monitoring patients at home. You may even need to augment your staff with other remote staff. So having the right partners that you can bring on board that understand these programs is so key. Look, you can't do it alone. As a physician, as a medical practice owner, a clinic owner, you're trying to do so many different things, right? The number one thing you should kind of focus on is what you do best. This is seriously the best way to improve is focus on your strengths. And by focus on your strengths, we've seen this time and time again, that allows for the best progress forward. So one of the things that we've seen been beneficial is partnering. Even we have partnered with organizations before to help us scale and grow and provide the best care. Think of providing more value to your patients. So what does partnering look like? You do it now. You have technology vendors that help you with the EMR. You have IT staff that help you with new solutions. You bring in consultants to help you with staffing issues. You have CPA to help you with your books. Likewise, having certified or individuals that understand these remote care programs to such a level is going to help you succeed even more and beyond what you can expect. So really sitting down with the right partners, and the way to evaluate partner is 3 levels. Do you know, like, and trust? Do you know who they are? Have you heard their reputation from other folks? When you sit and talk to them, do you like them as individuals? Do you feel like this is someone that can get you excited and you guys can work together? And then last but not least, do you trust them? Do you feel like they have integrity? Integrity means they say what they're going to do, but also trust means that they're competent. It's 2 sides, integrity and competence. That's what trust is about. Making sure you understand that they know what they're talking about and can do the work at a scale that you need to get to 1,000 patients. And also, is this someone that says what they're going to say that they're going to do? A lot of times people talk, but they don't implement at scale what you need. Having those partners in place is success. And then last but not least, you want to have a way to continually improve the program. Having monthly meetings. This is simple. Stephen Covey talked about is called sharpening his saw. Making sure any process you put together is consistently improved upon so that it can get better and better all the time. These programs are changing all the time. Every year, the physician fee schedule comes out and there is a new code or new tweaks to the old codes. So you need to be aware of that and how you can change and adjust accordingly. Insurances are changing. Understand what insurance accept what. You may have different goals for the practice, right? And where you want to go. So understand how that adapts. Having these monthly, quarterly meetings to continually work through that process will help you scale these programs even faster. When you put those together, when you look at understanding the programs at scale, understanding the workflow that you want to implement for every step of the patient journey, understanding how to create that patient-first culture internally. Then you want to understand how to partner with the right people to continue to scale up and finally sharpen the saw, continually focused on making a better and better mousetrap, if you will. So if you do these steps, you will be able to scale to from 0 to over 1,000 patients with any remote care program. We've seen that time and time again. As you can see with practices over and over again, they see the benefit of these programs. It's better for patient care. It's better for the practice for monetary standpoint. But ultimately, this is where healthcare is going. Go ahead and start today. Let us know in the comments if you started this process and where are you in your journey from 0 to 1,000. Even if you get started today with 10 and be on a much better path to success. Please comment below, let us know, look at some of our other videos and see which one can help you along the path to this new paradigm and shift in healthcare that can walk you through and help you not just survive or thrive in this new model of healthcare.